to the room.
All right. Good afternoon. So can I confirm your name and age, please?
I'm Lynn. I'm 25.
All right. And how would you prefer I address you today?
Lynn is fine.
Okay. So Lynn, I see that you've come in with the history of having recurrent nosebleeds. Is that correct?
Yes, doctor, and I'm getting a little worried about this. I've been having these bleeds a little too often this month.
And how often is that over the last month?
Well, I've actually noticed that it usually happens in winters, and it's been like about like every 2 to 3 days.
I'm sorry about that. That's very quite frequent. And do you bleed from both nostrils or it's just one?
It's just I've only noticed it from my right nostril.
Okay. And how long does the bleeding last? And would you be able to quantify how much blood you lose at each time?
Oh, well, it's not a lot of blood. I mean, and it's kind of like 5 to 10 minutes. But yeah, I'm trying to understand why this is happening.
Of course, I'll do my best to find out what the cause might be. So what do you do to stop the bleeding at each time, or it just stops on its own?
Well, in like 5 to 10 minutes, it kind of does stop on its own, but then I kind of pinch it and lean my head backwards.
All right, all right. So do you bleed from anywhere else in your body, or it's just from the nose?
Um, Bleed from anywhere else? No, it's just from the nose.
All right. And has it happened? So you said it's usually during winter. Is it getting worse or better?
Um, I mean, I think it's usually, I kind of feel it more prominently during winters, especially when I'm moving from a warm place to a cold. Every time I'm stepping out, kind of have the sensation, you know.
Okay, okay. And do you have a cold or a cough whenever this happens?
No, not really.
All right. Do you have any nasal congestion?
No, not exactly.
No difficulties breathing?
No, difficult.
All right. And is there any discharge from your nose besides the blood?
Not that I've noticed. It's just this few streaks of blood. But yeah, I get a
Oh,
little stuffy when that happens.
okay. And is there anything that you've noticed that makes it worse or better?
Well, when I moved from, like I mentioned, from a warm place to a cold, like especially stepping outside.
Okay, okay. Um, that's all right. And have you noticed any fever when these nosebleeds happen?
No, not really.
Okay. Have you had any loss of weight recently?
No, not that I've noticed.
Okay. Have you had any loss of appetite or noticed any lumps or bumps on your body?
No, doctor.
Okay. No sweating at night either.
No.
All right. And just lastly, have you noticed have you had any injury to your nose before this bleeding started?
No, not really.
Okay, that's fine. Just want to move on to find out some other things. Uh, are there any like long-term illnesses that you're currently being treated for?
No, doctor.
All right. And you're also not on any medication, including blood thinners?
No, doctor.
All right. And just to find out, are you on any recreational drugs? For example, cocaine involves sniffing through the nose. Is that something you do as well?
No, not at all, doctor. Of course not.
All right. Seems a bit invasive, but just trying to um, find out what the cause may be.
No,
And sorry?
I don't do cocaine.
Okay, no, that's fine. And in your family, is there anyone else who's had any similar issues?
No, not really.
Okay. Are you allergic to any medications?
No, doctor.
Okay. Um, and sorry, just to ask again, do you pick your nose?
No, I try to stay away from that area.
Okay, no, that's fine. And do you drink or smoke, Lynn?
I drink occasionally, yeah, and I do smoke from time to time.
All right. And would you be able to quantify for me how much smoking or how much drinking that might be?
Well, occasionally with friends, probably on the weekends.
Okay.
2 minutes remaining.
All right. So I just want to ask, is there anything that you think might be causing this nosebleed?
I have no idea. I was hoping you could give me some clue.
Of course. And is there anything in particular that you want me to address today? And what would you want for us to do at the end of this consultation?
I don't know. I've read somewhere that it could be because of some bleeding disorder. I just want to find out if it is.
Of course. All right. So I just want to move on to do an examination. Well, check your vital signs, do a general examination, as well as do one more specific to your nose, so I can inspect it and see what might be going on there as well. All right. Okay. So, Lynn, putting together the information that you told me, as well as the findings on examination, I think your nosebleeds are caused by the fact that the blood vessels in the nose, they're quite close to the skin, and when it's winter, you tend to blow your nose a lot, which would then cause the nosebleed. Does that make sense to you?
I don't usually blow my nose as much.
Sorry?
I don't usually blow my nose.
Okay. Well, it's just a suspicion for now, but we'll just do some investigations to see what the cause might be. So some of these investigations, they'll include checking the blood immune system, if how it is. We'll also do something called a clotting profile and something called an INR. This will rule out those bleeding disorders that you fear that you might have. Is that okay?
Move on to the next statement.
All right, Dr. Natasha. Good job. So, why did you think that it was due to blowing the nose? That was not a positive history that she gave. You asked about sneezing and a whole lot of things, but she said negative history on that, right? So, how did you extrapolate the fact that it was due to the blowing of nose?
So you said it's mostly during winter. My suspicion was maybe she'll have a cold or a runny nose, and then that's how the bleeding starts.
Uh, yeah, that's definitely a risk factor to consider. But so this is a case of epistaxis. So you were absolutely right. This is usually because the blood vessels in the nose, it's called the anterior plexus or the Kesselback plexus. I really like the way it's off your tongue. This is very close to the skin, and it's in the anterior septum. And usually, it's the dry, cold air that kind of makes these vessels friable. So it's spontaneous bleeding. All right. So
Mm-hmm.
it need not be that they actually are forcing, they are kind of having any positive pressure that is causing them to bleed, like sneezing or cough or fever. It's a spontaneous bleed. But these other things can definitely aggravate that for sure. Main reason is because these vessels get dried up and they're very friable, so they're easy to bleed, right? So
Okay.
it's very common among youngsters, especially in that age group of 25, right? Adolescent and young adults, right? So if you
Mm-hmm.
can, this patient is actually 25. So what are the things that you need to be worried about in this patient?
One thing that I noted that I didn't ask were the symptoms of anemia, considering how often she's having the nosebleeds.
Absolutely. That's a good one. That's a good one. Yes, absolutely. Like dizziness, fatigue. Yes, absolutely. And what is the differential that you would be worried of? And okay, so there is, if at all you hear an anterior plexus, so there will definitely be an opposite of that. So there is also posterior plexus.
Mm-hmm.
That it's called the Woodruff plexus. Have you heard of this plexus? Blood vessel plexus?
Yes, from anatomy.
Yes, absolutely. So what exactly happens is this plexus also bleeds, and it's a more dangerous bleed in this case. All right. And
Okay.
usually this happens in adults. I mean, more elderly people with more, health risks like hypertension, atherosclerosis. So this is mostly a venous plexus, and this bleeds. And when this bleeds, it goes to the back of the neck. So back of the throat. So there is a risk of aspiration. So you just want to quickly rule that out, when you bleed, where does the blood go? And it's a little more quantity because of the underlying health conditions. This one also, now when you're looking into young people and streaks of blood, and that to anterior bleeding, where it's actually, they are actually bleeding from the nose, and you see that, it's not going to the back of the throat, then you're thinking of anterior plexus bleed. All right. So when you're thinking of
Okay.
anterior plexus bleed, I mean, any other nosebleed in young people, what are the things that you should be worried about? And also, this is unilateral, just one nostril. So what should be coming to your mind where you should rule? What should you be ruling out? Yeah, just the top of your head.
Drug misuse.
Foreign body?
Foreign body, all right, but it's kind of frequent, right? Foreign body, you can, she has no nose picking, what do you say, habits. Nothing is actually gone in. Yes, go
Could it,
ahead.
could it be like I don't know, like a malignant mass on one side of the nose?
Absolutely. It could be a tumor. Usually unilateral tumors actually do present like that, right? And there are also some vascular malformations that are very frequent in young adults. Polyp, yes, Dr. Farah was also saying that's benign, but it's still suspicious. It bleeds. Polyps also do bleed, right? Definitely. It could be some vascular malformation as well, right?
Mm-hmm.
And that's what you need to keep in mind. So your stuffiness question was very good. Is your when you do feel this way, is it usually that you feel stuffy? Do you feel stuffy on one side of your nose, or both side of your nose? Do you feel like there's a mass? That's a good question, because you're thinking, why is the bleed happening? Is it happening spontaneously? Because spontaneous bleeds are very common. Let me assure you that spontaneous bleeds are very common. But the main thing that you have to do is you have to rule out any dangerous, symptoms associated with it. Do you understand?
Okay. Yes,
You,
yes.
you have to make sure that it is something that is not too much of a health risk. All right.
Okay. Mm-hmm.
So definitely think along those lines. So you asked a lot of good questions about coagulopathy. How much is the quantity of the bleed? You want to see, the amount of the bleed. Usually and how long does it last, the bleed? Those are all very good questions, right? So you want to make sure that it's not a dangerous bleed. So when do you call a bleed dangerous?
Hello?
Yes, I was
Oh,
hoping
sorry.
somebody would answer that. How long should you wait for it to be called dangerous? It's something around 20 minutes, right? If it doesn't stop. And there was also another thing that she said, what do you do when this bleed comes on? That is a very good question. I really like that question. So I kind of improvised a little bit where I said that I pinch it and I go backwards. Is that correct? Should you be doing that?
No, you should actually be leaning forward.
Absolutely. So that's an issue you found in this. Very good. So that's why you have to. So when you're talking to these people, patients, you need to understand what is their current practice, and anything that they're doing is actually wrong or right. Right. So that you can bring it back in management. So whenever you're asking the questions, make sure to ask questions in such a way that you can have a management for it. So identifying that she is doing all this is a clue for you that, all right, I need to speak about this in management. All right. So good job on identifying that. So we'll quickly take a look at the results. Yeah, so since this is a case repeat mock, we actually have put this in, our mock format. So this is usually the format that we follow for our personalized mock. So I'll just pull that up. All right, I'll just share my screen again, guys. I'm so sorry about the delay. Okay, so let's confirm the full name and age. I actually on purpose did this for you. In fact, you started by asking, can I confirm your name and age? I said Lynn. But what is the full name? You should always, ask the full name, because those are your identifiers. There might be another patient named Lynn. So accidentally also, you shouldn't be talking to another person's medical information. You shouldn't be sharing, disclosing any medical information to another person. You'd be liable for that. So definitely ask the full name and age, the identifiers that have been given to you. So do take heed of that. Ask about the concerns, clarify the nature of the event, ask the patient to describe the episodes in their own words. Yeah, I think I'll give you partial for this. I wouldn't completely penalize you on that. Ask about the frequency and duration of every episode, assess the severity, clarify the site of the bleed, whether it's from one nostril or both. That was done very well. Inquire about the specific triggers. I think this you actually asked twice, so whenever you're asking the question, try to avoid repeating your questions because you get ticked in listening. All right. And you need to actually learn how to understand what they are trying to say from the first go itself, and then from the Socrates you need to rule out what all questions you need to ask and not. Right, because because in the first time you actually ask them to explain it in their own words, they may they may cover a lot of the Socrates, so you can't just keep asking the same question, so you'll get ticked on listening for that. So keep a mind of what all they have already answered. Maybe you could have asked this question by saying that, apart from the change in temperature that you notice that causes the bleed, is there anything else that triggers the nosebleed, or is there anything else that makes it better or worse, rather than just asking that question plainly? Because remember, you're having a conversation with this person. That means you're actively listening to what they have said, and you have in your conversation that should. Does that make sense, Dr. Natasha?
Yes.
Okay. Quantify the bleed. Ask about whether there is blood dripping down the throat. This is very important because you need to understand whether it's a posterior or anterior bleed, right? Even though posterior is mostly seen in elderly with a lot more comorbidities, you should rule that out, definitely, right? Screen for red flags, headache, dizziness, palpitation, shortness of breath, fever. Yes, absolutely. Dizziness and palpitation is something that you could have asked when you're thinking of anemia here. Ask about bleeding tendencies. I think I'll give you a full for this one. You did ask about this, any coagulopathy, right? Recent cuts. Yeah, any place where you have had an injury. How much do you bleed usually? Does it come? Does it stop almost immediately, or does it prolong for a longer time? Review past medical history, surgical history, especially history of nasal trauma, surgeries, allergies, and known blood disorders. Yeah. Explore family history of bleeding disorders, and yes, you did do this. Do you have any family history? You asked this. And then examination. So your data gathering was pretty good, but I think you can still pick the questions you need to ask. Because if you notice, you only got to management when there was just 1 minute left. And do you understand how many questions you were asking for data gathering? I think you were repeating a lot of your questions. And another good question that you asked is about the cocaine use. That's very good questions. The nasal insufflation is one of the signs that you've seen in cocaine users. But do signpost when you're asking such an uncomfortable question, right? You can't just jump to the fact that, are you doing cocaine? Is that why you're having a nosebleed? That's a very uncomfortable conversation you're going to have, right? So do try to avoid doing that. But apart from cocaine, alcohol smoking, what do you guys think? You know, does that aggravate this nosebleeds?
Wouldn't those slow your wouldn't they increase your bleeding time? Actually.
Bleeding, so usually when you're thinking about bleeding time, you have to think about coagulopathy. And the other thing that can increase your bleeding time is any liver disorders. All right.
Okay.
When you're thinking along those lines, maybe. But what do you think otherwise? Alcohol and smoking, will that make it more problem? Your bleeding, nasal bleeding? Alcohol, not so much, unless you have too much to cause any liver damage. But smoking, definitely, because it causes direct trauma to your nostrils and your throat, right? It causes local injury, right? There is so much of irritation by the particulates that is coming from the smoke. So that will aggravate it. So definitely smoking you need to think of. So confirm on that. That's a good question. So definitely if you identify, so in my information it was not given, I just wanted to, you know, add in that. But definitely when you're thinking along those lines, you're thinking of any risk factors that can aggravate this problem, right? So what you're doing in data gathering is you have in the back of your mind, all right, you have a presenting symptom of epistaxis, nasal bleed. Now you have to understand if it's anterior, posterior, you have to quantify it, you have to understand how long it lasts and what she does, right? Perfect. Once you've gotten that, rule out the risk factors, you know, the most dangerous risk factors. That could be, you know, any polyp, any, you know, do you have other than the, what is it, blood, do you have any other discharge coming? You know, do you feel stuffy on that side of the nostril, right? Identify if it's unilateral or bilateral. And any bleeding disorders, any family history, any other underlying health conditions like hypertension, right? Or any atherosclerosis that she might be having. After you understand that, you have kind of got the fact that this is what we say nasal bleed, I mean epistaxis, right? A benign one. So think of all the habits that can be a risk factor. So you very beautifully asked about the nasal picking. That's good. Now you have to think about anything that might aggravate it. So you understood that, you know, the cold is something that is aggravating it, and that is the desiccating effect, that is the drying effect of the cold. So you have to also think about other risk factors like cocaine and smoking that you did, just to understand what is her overall habit when it comes to this disease, you know. Understand a little bit about, a very good question to ask is how this is affecting your daily life, you know. So then she'll actually tell you, like in her own words, like, yeah, this is very troublesome, and she'll actually tell you her concerns, right? And what, and then definitely ice. But when you're doing ice, definitely do the entire thing: ideas, expectations, concerns, and expectations. Expectations are a very good question to ask. That way you will understand what your management should be focused on, right? Everybody asks still concerns, but nobody goes on to expectations. Like, what are you expecting from today's consultation? What can I do for you today? Right, so that's a very good question to ask, definitely. Yes, so explain epistaxis. Yes, epistaxis is due to the frail nasal blood vessels aggravated by dry air or trauma. You ruled out trauma as well, that's very good. Ensure the patient, reassure the patient that it's common and usually not serious unless accompanied by other warning signs. So you can talk about the other warning signs like the easy bruising, excessive bleeding time, right? Any other sites of bleeding, right? Demonstrate the first state, pinch the soft part of the nose, lean forward, hold for 5 to 10 minutes, and use cold compression. Why would you use cold compression? Why is cold compression so important?
Because it would constrict the vessels and reduce the bleeding.
Absolutely. Yes, absolutely. So yes, and that also you identified, like, what is her practice? She usually pinches her nose and leans backward, and that is a risk of aspiration, right? And you don't want that. So you have to rectify that, right? Advice against nose picking and blowing the nose forcefully. So even though, you know, she doesn't have these risk factors, you can say that the things that do aggravate it. So please do keep a mind out for that, right? Recommend nasal spray to keep nasal lining moist. So this is very important. So this is what is actually causing the bleed, right? So you can actually give her nasal sprays. You can also give her some petroleum jelly that she can apply on her nostrils, to prevent it from drying out. Yeah, advise use of humidifiers at home during winters and in a dry environment. Mention nasal cautery with silver nitrate as a next step if conservative measures fail. Yeah. And then provide safety netting, leaflets, and follow up. These are very important. This is something that we tell everybody in all this. See, you could have done so many things with management, but by the time you came to management, it was only 1 minute left. Right. So do you understand? You can cut down a lot on your data gathering because you didn't manage to get much marks in management because of this. Right? Unfortunately. And there are so many things to cover. Don't worry, we'll try this again. Yeah.
Okay.
All right. So good luck, doctor. I'll just quickly share my screen again.
I just have a couple of points to add. So one thing I noticed in your data gathering was you asked, so you started with a closed question. So when you, after the presenting complaint, always start with an open question first. You ask, tell me more. You directly say, tell me more. They'll tell you a lot of things. That will cover a lot of your close. You started directly by saying, how long have you been having this? All right. So try to avoid that. Because that will take you into a path where you can't really go back and ask an open question again. So that is one thing. And another is you need to have a structure for your data gathering. It's kind of haphazard. You're asking questions, so you asked about recreational drugs first, and then after a few more questions, you went back to smoking and alcohol. So always make sure you have a structure, and your data gathering is way too long. 7 minutes. That's way too long. Make sure that it's only 4 minutes. And how you do this is, and for a station like this, which is symptomatic differentials, where you have to mainly focus on differential diagnosis. And these are the stations that have the best structure, because there's nothing much you don't need to focus on. All you need to do is ask your questions, pinpoint questions. So you start with presenting complaint, go to ask about presenting complaint, like elaboration, which is Socrates or Odipara. And immediately after that, you do your differentials. So differentials, you don't need to ask everything. Think about 3 C's, that is critical, cancer, and common. So that is, first ask what is the most critical thing that could be causing this. So here it could be, bleeding disorders. And then ask about cancer. So cancer, all you need to do is rule out weight loss and loss of appetite. That will remove that. All right. And after that is most common, which is just general epistaxis, right? So these 3 things, and once these three things are done, you rule out red flags, and then do your PMAF. Those are the past medical history, allergies, family, in smoking, alcohol, and then psychosocial histories, like how is it affecting your life, and that is very important. And then after that, you do your eyes, and then you move on to your management. Even if you don't get your diagnosis till this point, it's all right. Don't keep dwelling on data gathering anymore. All right. And definitely move on to management as soon as possible. Like 4 minutes is your cutoff for your data gathering. Try to practice that. And if you don't get your diagnosis, you still can manage your, you still can try to say whatever differentials you're thinking of. You can say you'll talk to your senior. All these you can do in your management. You can still get marks, because if you just continue doing more data gathering, you'll lose everything in your management.
So, yeah, let's go for another round. What do you say?